Good afternoon, everyone. We're so lucky today. Don't you know that today is the 12th anniversary of the Philippine Statistics Authority, PSA, and Dr. Lisa Bersales is the very first national statistician and head of PSA. Let me introduce her first. So Professor Lisa Grace Bersales is a statistician in the Philippines and Professor Emeritus at the UP School of Statistics. She is currently the Undersecretary on Population and Development and is Executive Director of the Commission on Population and Development of the Philippines. Her significant contributions include the following. She is the first national statistician of the Philippines and she led the implementation of the Philippine Statistics Act of 2013 by setting up the Philippine Statistics Authority in 2014. Globally, her significant contributions include being co-chair of the UN Interagency and Expert Group 2017 that developed the global indicators for the Sustainable Development Goals. In 2014 to 2017, the vice chair of the Regional Steering Group for the Civil Registration and Vital Statistics, Decade of Asia and the Pacific from 2015 to 2016. And she's a member of the team that wrote the very first World Report on Health of Refugees and Migrants for WHO from May 2021 to January 2022. And if ever you visit Bacolod, she knows all the best restaurants there, including that cake shop where you were and invited you for this. So let us all welcome Dr. Lisa Grace Bersales.
Thank you so much, Carl. It's my privilege to be here at the School of Economics, PCED, to talk about demographic trends of the Philippines. And nasabi ko nga, parang nakakabahan ako. You know why? I've not been talking to young people in the university for a long time. Because when I was appointed Vice President for Planning and Finance, I decided to focus on administrative work and research. I did not anymore have classes. So it's really my privilege, and thank you, Carl. We were having coffee, Manny and I were having coffee in the famous cake shop in Bacolod, Calea. And then biglang dumating itong si Carl. And because they were having a lecture for the National Wage and Productivity Commission. And dito nga, we're talking about, first we talked about the family size, no? Household size. And then, yun na nga. So thank you very much. I would like now to show you what I prepared for us to talk about today. So it's demographic trends in the Philippines with really the goal that for us as a country to really reach the demographic dividend. But for now, it's optimizing demographic opportunities towards sustainable and inclusive development at all levels. So I just have three main areas of discussion. I want to talk about the Commission on Population and Development because not everyone knows about CPD. And nag-usap kami ni Professor kanina, POPCOM ang mas nakikilala. Then, what are the demographic opportunities and persistent population issues? But because I'm here in academia, I would like to share with you the research agenda of the Philippines on population and development and the research gaps. We really need you to help us address research gaps. There are a lot of questions on why and where to focus on. The Commission on Population and Development was first created in 1969 by the father of our current president. So he created, it was not just an office, it was just a 20-member commission called the Commission on Population to address the increasing list of concerns associated with population growth. During that decade, there was a global meeting on the exponential growth of populations in the world. and the Philippines, among them, also participated. I will show you later that the growth rate of the Philippines has declined through the years. But at that time, it was among, like other countries, a high level. So this commission on population was tasked to study. This was more really academics. I don't know if you know Dr. Mercedes Concepcion, she led this. So the focus was more like a think tank, talking about the issues on population growth. And this was followed by a Republic Act in 1971, where the law created the National Population Program and created the Commission on Population under the Office of the President with this RA called the Population Act of the Philippines. And as you know, this has not changed. We don't have a new Population Act, despite the fact that we now are in a different situation in terms of population policy, population issues. And that following year, the President issued the presidential decree, which actually listed the different functions of the Commission on Population. And it was then that it became known POPCOM. So that was 1972. In 2018, the POPCOM was renamed as Commission on Population and Development. So CPD na siya ngayon, and reattached to the National Economic Development Authority. So in the beginning, the commission was attached to the Office of the President, then it was attached to, ang dami niyang attachments, Office of the President, DOH, DSWD, NEDA, then back to DOH. So in 2018, the focus was not just population, but population as it affects the development of the country, thus the attachment to NEDA. And just this year, Republic Act 12145 created the Department of Economy, Planning and Development, or DepDev, and there's a section there that lists CPD as an attached agency. So sana hindi na kami transfer. Now, the vision of the Commission on Population and Development is that we serve as the lead agency in advancing the country's population and development policies and programs towards increased share and opportunity of each Filipino in his socio-economic progress. You will see the change in the character of POPCOM to CPD, whereas before it just focused on population growth. Kaya yung pagkakilala sa POPCOM before was family planning. But family planning is still a strategy. It has not changed. It's still there. However, it's not just family planning, which is a population intervention, but there are still other issues. And we are now looking at a more holistic narrative for the population program of the Philippines, which is looking at our citizens' journey from womb to tomb. So hindi lang siya family planning, mga women of reproductive age, but we talk also about older persons now, considering that many of the countries like us are becoming aging populations, and we are projected to be an aging population defined by the UN by 2030. And the definition is 7% of the population are aged 65 and above. But we are not yet worried about being an aging population like Japan, because our population is growing and we still have young 30%, 33% share of ages 14 and below. The mission is to strengthen institutional capacities, to formally coordinate, implement integrated population and development strategies, policies and programs based on socioeconomic and demographic data, information and knowledge. So I always explain that the CPD is not going down to citizens, women and couples to provide services, family planning services specifically, but we are now focused on strengthening institutions. And with the devolution transition plan of the CPT approved in 2018, we are really going down to the local government units to provide technical assistance to population offices, local chief executives, about what population and development really means and why it is very important for them to consider population issues in their plans, like comprehensive development plan, comprehensive land use plan. So we are also tasked to craft a population and development program for the Philippines, and we were able to develop the Philippine Population Development Plan of Action for 2023 to 2028, which supports the Philippine Development Plan but focused on population issues to support the Philippine Development Plan. And the goal of the Plan of Action is to optimize demographic opportunities and address persistent population issues and challenges for us to reap demographic dividend, accelerate sustainable and inclusive development at all levels. So the President has approved this, and he issued a Memo Circular 40 instructing all national government agencies to implement and enjoining local government units to do the same. So let me focus. So what are these demographic opportunities that we have to take advantage of, and what are the persistent population issues? So we focus, let me start with what is our population growth now. I mentioned to you that in 1969, the President then created the Commission on Population because of the growing population of the Philippines. At the time, population growth was 2.9%. And just recently, the Philippine Statistics Authority reported the result of the census 2024. So they did the population census community-based monitoring system last year, and they reported the population growth as now 0.8%. So we are still growing, but the growth has decelerated. The 2020 estimate of the annual population growth rate was 1.6%. So we actually grew about 3 million from 2020 to 2024. Our current population as of July 2024 is 102.7. And so this is a demographic opportunity. But I would like to emphasize that the population policy of the Philippines has basic principles. So we subscribe to human rights. We subscribe to non-intervention, which means that women and couples have all the right to decide on number of children and how they will space their children. So we are very clear about it. So when I'm asked, so how many children do you suggest for women to have? And I say, I cannot make that suggestion because each couple has to make that decision. But the role of government is to provide them with all the information for them to make the proper decision. And so we are still there. This is how the age-sex pyramid looks like. I am showing you only the 2015 and the 2020 because PSA has not yet released the age-sex pyramid for 2024. So as you can see, in 2015, we had this as the share of the three groups. Older persons, 5%. Working age population, 63%, young population, 32%. And the change is slow. In 2020, the share of working age is 64%, 31% for young, and still 5% for the older persons, although you can see the level of increase. The household size in 2015 was 4.4, 2020 4.1. I was just talking to NS Dennis Mapa earlier with Dr. Esguerra, and he told me that, so the household size is really estimated at 4 now, but he is pointing out to me that we should also look at the granular information. So for the bottom 30%, the median household size is 5. And you can see later on, when I show you the fertility rate of women by socioeconomic status, the differences in total fertility rate across different population groups of women. And so the persistent population issues are on the details, are on the granular information, and specifically on specific population groups. And this is where the Commission on Population and Development is trying to focus, to alert different stakeholders that, yes, on average, this is our situation, but please let us take a look at different population groups' concerns. And this is now total fertility rate. This is based on the National Demographic and Health Surveys. I guess the values are not too clear. In the 70s, the number of children per woman in their reproductive life, on average, that's total fertility rate, was 6 children to a woman. So during that time when President of Marcos Sr. created the Commission on Population, that was the number of children on average of women of reproductive age during their whole reproductive life. Now, with the result of the 2022 National Demographic and Health Survey, it's 1.9. And this was a concern when this was released in 2023 because the drop from the previous estimate of total fertility was quite steep. It was, the total fertility rate was 2.7 in 2017. So nagtanong yung mga tao, was it because of the COVID-19? Was this a COVID-19 effect? The USAID did a study on the quality of data of the NDHS 2022, and their study resulted in no problem with quality. And now we see that the population growth rate, as I've shown you earlier, in 2024 from 2020 is also looks like a steep drop. This is validation of the total fertility rate recorded by the National Demographic and Health Survey in 2022. So if I may share with you how I laymanize 1.9 fertility rate when I talk to local government units and I visit them and I say, what does this 1.9 number of children per woman for their whole reproductive life on average mean? So I said, in the past, if a barangay captain invites 10 women to an event and he says, bring all your children with you, he will have to prepare for 10 women plus 60 children, so 70 people. Based on the 2022, if he or she invites 10 women, he or she will have to prepare for 10 plus 19, so 29 na lang. So from 70 to 29, that is the impact of the less than low decline in population growth to how we provide resources to our citizens. And as I've mentioned earlier, based on the population projection of PSA, based on 2020 census, we are going to be classified as an aging society by 2030. So the blue line is our line showing the 15 to 64, the working age population. This is our older persons. I don't know, is this purple? And the orange is our young. So as we can see, hindi pa naman yung young ay bumababa masyado. It's really the two groups of people that we are monitoring. However, I am alerted not to focus too much on saying we will be aging at 2030. Kasi ang reaction ng mga local government units, local chief executives, hindi na kami mag-over ng family planning, we're aging na pala. So sabi, no, family planning is not about controlling number of children. Family planning is about giving information to women and couples on how they should decide on number of children. And aside, we did a qualitative study, Commission Population Development. We commissioned a group to do a qualitative study on fertility intentions of women these days. And what we found, the result we found is this: women and couples are delaying getting married, delaying having children. But they say they still want to have children. And for me, this is what is very important for the government to provide information to help these couples make decisions as to, so how long will you delay these kinds of decision? We should be providing guidance. And so delaying marriage, cohabitation is on the rise. The latest report of the PSA says that registration of marriages is going down. The National Demographic and Health Survey in 2022 already showed that cohabitation is on the rise. And the report of the PSA on registered live births show that there is a rise in number of children of non-marital status. Medyo hindi na masyadong ginagamit yung word na illegitimate, but so we now call illegitimate non-marital status children. So dumadami yung non-marital status report of live birth. Personally, hindi siya masyadong problematic kasi meron ng laws that protect illegitimate children. So they have the same rights on inheriting as legitimate. Yung mga issue lang ay yung i-recognize ba sila ni tatay. So dapat sa registry of live birth, talagang nakasabi na the father recognizes this child as his. And he gives authority for the child to use his surname. Yung ina-alert, hindi ko alam how to give these alerts for the partners. Because if you are not married, legally married, walang right ang partner to make decisions for the partner. So there are cases, when I was a civil register general, yung dadalhin, matagal na silang magkasama, may legal spouse na ospital. So when you go to the hospital will ask you, what is your relationship? If you are not the spouse, you cannot make decisions. And consequently, if the partner passes away, only the legal spouse can get the birth certificate. So marami akong experience na nag-appeal yung partner para makuha yung death certificate. Talagang hindi pwede kasi Data Privacy Act, only the spouse can get it. So may mga ganon akong experience about this, the consequences of cohabitation. I'm sorry. So these are just a small list of demographic opportunities. I already showed you population growth is steadily slowing down. So what? Ito yung sinasabi ko, when we have lower population growth, resources for citizens can be provided in a better way. That's the only way I can say it. And my example was about total fertility rate of 6 versus total fertility rate of 1.9. Working age population is increasing and age dependency ratio is lower, so less dependence per working population. Filipino women are more capable to achieve their desired number of children. So this comes from the result of the National Demographic Health Survey. Better educated population, of course, we know there are still, however, challenges about the quality of education. Filipinos are healthier, living longer, and more. We have a more resilient population, and this is seen by the increasing share of older persons and increasing labor force participation among women. But of course, there are persistent, I will just say what are the persistent issues, especially as regards the last one here. I just would like to share the connection between the social issues and economic development of the country. Usually kasi, when I attend planning sessions, the focus really are on economic indicators. And although the Sustainable Development Goals put to fore the social indicators as well, like poverty, hunger, women empowerment. But mas na-highlight kasi yung GDP, economic development, labor force participation. So the Commission always says that there is a connection between the population issue and development, economic development in particular. So we looked at some of the studies that have been done by our researchers, and Balisahan ng Mapa 2004 pa ito showed that 1 percentage point increase of the working age population results in an estimated 1.79 percentage points increase in economic growth rate. So this is what we are emphasizing to the local chief executives, that we really have to take a look at how your working age population in your locality is growing or slowing down. And support ratio is really the number of effective workers to effective consumers. No? So it's another. It's like a dependency indicator, but looking at workers versus consumers. And a study by MAPA resulted in this, that the support ratio will be greater than 0.5. And we want the support ratio to be higher, starting 2025, and it's this year, but only with full employment, in addition to the lowering of fertility rate and increasing the years of schooling. So actually, itong dalawang sinasabi dito, lowering fertility rate, increasing years of schooling, have been actualized. Pero nakikita namin, mahirap pa itong full employment because labor force participation rate is still low, even if it has increased through the years for women. Still low pa siya compared to men. And of concern is still nutrition issues of the young, stunting and wasting pa rin. And nung pinresent ng Department of Education yung National Achievement Test results nila noong 2023 sa Social Development Committee, lumabas doon on average, failing lahat ng grades 10 and 12 natin sa 21st century skills, like critical thinking, the use of data, reading comprehension. Imagine, failing po lahat, grades 10 and 12 on average. But if we look at certain groups, merong better ang performance. Girls performed better over boys, urban over rural. Okay. And so that was the presentation. And the National Nutrition Council said, oh, ito yung cohort na ang taas ng stunting and wasting. So kinonect niya na kung ang malaki ang percentage ng stunted, wasted children, through the years, makikita natin sa education indicators. Also, poverty incidence is projected to decline from 19% to 9% in 2032. Of course, COVID-19 happened. However, nag-decrease naman ang poverty incidence natin. And the number of poor population is projected to decline from 20 million to 12 million. This is by Abrigo and Herring 2018. Again, this was before COVID, so mayroong certain adjustment dito. And now, we not only talk about demographic dividend. So of course, demographic dividend is the socioeconomic growth that we enjoy with the changing population structure. So the expectation is if you have more working age population, less dependents, you will have more social economic growth. That's really demographic dividend. And si Secretary Ernie Pernia talagang very passionate siya. We are not yet there. So Lisa, yung CPD, ayusin niyo yung mga reproductive health family planning ninyo. The UNFPA now is actually also alerting us that because we are like other countries going to progress into an aging population, we have to also find ways to achieve silver dividend. This is how the more older persons can contribute still to, bakit nakatingin si Carl kay? Kami ni Manny, kasama kami sa silver dividend. Oo. So ako din, I'm also, older person. I'm still contributing, I believe, to population. Si Professor Alburo. So, kaya nga, narinig ko na naman sa Congress na yung bill to lower retirement to 56 is still there. And that is not going to help with silver dividend. In fact, I attended a meeting with IMF researchers from Washington, D.C. They presented their study about how countries achieve demographic dividend, and they emphasized silver dividend. Sabi nila, ang Philippines is good. Yung atin daw na retirement age is among the better ones. Kasi may rule of thumb sila na ang gap dapat nung median age at saka nung retirement age is 20 years ba yun? Sabi niya, tayo okay ang Philippines. So the move to go lower retirement age will not help in achieving silver dividend. Okay. And so what are the persistent population challenges? Uneven distribution of population across regions. So if you look only at the Philippines as a whole, you think we are good, like the total fertility rate of 1.9. But if we go regional level, you will see we really have a lot of volatility or a lot of variability in terms of the characteristics of our regions and the other population groups. We also have still higher unplanned fertility among women and girls, among those with lower education, lower income, and in rural areas. I'll show you later the total fertility rate for this. And there are still women with low access to family planning information and services. Usually they are in GIDA areas, but also lower socioeconomic women say, we cannot access family planning services because we have to do this. We are still working. Example ko lang yung aking, yung pumupunta sa bahay to do cleaning. Sabi niya, ate, gusto ko na nga magpaligate, pero wala nga akong oras. So hindi ko siya masabihan, bigyan mo talaga ng oras. Pero that's her situation. And she has been with me for 20 years. I saw her children grow up. And I'm really sad because her children are all examples of adolescent pregnancy cases. So yung kanyang girls, naging pregnant while adolescents, yung kanyang boys, na-impregnate, nagkaroon naman ng partner na buntis. So now she is in a place where she is giving caregiving to her apos because her children have to work. So that's like, it's like, sabi ko, kawawa naman itong women in this situation. Of course, you already know, we crafted this report when we only had the PISA 2018, and we still have the stunting and wasting issue. And of course, yung walang katapusang problema sa maternal mortality rate, ano siya, yung ating maternal mortality rate, hindi naman siya umakyat talaga, pero para siyang nag-stagnate ba? And also, of course, still the under 5 mortality, infant mortality, and neonatal mortality rate. So we are not really doing well in these indicators. And so what happened to 2024 census of population? If you're interested in this, kasi maliit yung font. Sila Marie can provide, sila Carl can provide you copies if you're interested. So ito na yung sinasabi natin na ang laki ng disparities across regions. So sa 20, medyo na-cut ito, no? Ito yung 2015 to 2020. This is 2020 to 2024. The 0.8% is the estimated annual population growth rate for the period 2020 to 2024. Medyo napaaga yung ating mid-decade census. Dapat 2025 pa siya gagawin. However, PSA decided to do the community-based monitoring system and the POPSEN together. Kaya napaaga yung POPSEN. So as you can see, BARM is still increasing talaga. And Region 5 is the one with negative growth rate. So, hindi na siya nag-grow. So, ito pa yung tinatanong ko, ano kayang nangyayari? And I think we should be looking at this para makita yung nuances. There are 3 reasons for population growth: fertility, mortality, and migration. So, ang main driver talaga is fertility. But it's possible that migration is a reason for the negative growth rate in Region 5. And these, you can see the gaps of these, you see the disparities. And number 1 pa rin in terms of the population is Calabarzon. Calabarzon is really the in-migration region. So ngayon, we have a study on daytime population of NCR kasi yung migration pumunta na sa Cavite, Laguna, Bulacan, Rizal. And the MMDA, the local chief executives of NCR would want to know gaano pa yung bulge ng ating daytime population to prepare for the needs of the daytime population. And of course, always a disaster, yung what if the big one happens? So we should know how many are going to be affected. Si BARM, when we talk to the population office, talagang very honest sila, well, we want to grow. We want our population to grow. So the conversations we're having is, oh, that's your decision, but these are the factors that will help you achieve economic development. Your population, we should also have be productive, no? Yung good health, have all the opportunities in terms of education. If I may also share with you pala about opportunities, and I will make a list of sources of data. We have a lot of longitudinal data available for you to study. We have the longitudinal cohort study of the Filipino child, which is being collected by the inaaral nyo ng PIDS, pero ang nagko-collect ng data si University of San Carlos Office of Population Studies, funded by UNFPA. Then we also have the longitudinal cohort of older people na UP Population Institute naman ang nag-aaral. So why am I informing you of this? Because you are the ones we'll go to. You are our go-to people for answering why, what alerts should we have. And my concern personally, if I were asked, in all the population groups that we need to focus on, where would be focused? I would really want to focus on youth development. So one strategy of the Philippine Population Development Plan of Action is adolescent health and development. I am really worried about the result of the study of the longitudinal cohort study of the young Filipino child, because ang isa nilang sinasabi, yung mga bata daw natin, hindi na nagdi-dream. They don't dream of being a lawyer, being a teacher. They don't have that anymore. And you know why? Ano yung correlation na nahanap nila? It is the mother. The mother is not dreaming for their children. So ang laki nung effect ng mother sa children. And this is why one population group that I really would like to study, if you can, are families left behind by OFWs, or parents, and specifically by OFW mothers. Because if the mother is not there to give positive influence to the young, then where would the young go? And there are indicators, qualitative, that prevalence daughters left behind by OFW mothers ang adolescent pregnancy and VAUSI and incest. So these are worrying results. Given that the mother usually says, I am going out of the country to work to give my children better lives. But it may not happen because there's a person missing there. So kung ano kayang interventions gawin ng government, yun yung ina-alert namin sa DMW. So this is another persistent issue where despite lower fertility rate at the national level, regional disparities exist, with poorer women, those with lower level of education, having higher fertility rates. Now, I would like to emphasize that through the years, fertility rate of all women, whether whatever educational attainment or wealth quintile, lahat bumaba. Bumaba ang fertility rate even of poorer women and those with lower education. However, mas mataas pa rin ang kanilang fertility rate compared to the other women. So, hindi ko nga itong maintindihan, why is it that ang no education, lower pa siya sa elementary? But maybe we can just group this together. So, mga 2.6 siguro ito. But look at how different it is for women who have finished high school and who have a college degree. So ito yon. And I actually requested Mike Agrigo, Mike, pwede mong aralin ng PIDS, yung fiscal implication sa ito, yung with higher education, mas konti yung women, ang mga anak ng higher education, correlated naman usually ito, at saka yung wealth quintile. Look at the wealth quintile for for the upper wealth quintiles compared to the lowest, which is here. And of course, rural, mas mataas pa rin compared to the urban. Let me tell you that in Metro Manila, despite the density of people in certain areas, the total fertility rate is 1.2. So yung Metro Manila, kaya siya dumadami, hindi sa fertility. Migration pa rin yun. Ito na yung sinabi kong study ng USAID about the National Demographic and Health Survey of 2017 and 2022. So sabi nila, the decrease, percentage reduction in total fertility rate, 15 to 49, this is your WIRA, the women of reproductive age, bumagsak siya talaga nationally, 27% ang reduction. Mataas sa urban compared to the rural. All regions declined ang fertility except for BARM. Ang BARM umakyat pa rin. Ang highest na decrease is NCR. So even if I said na baka yung increase ng population or density ng population is due to in-migration, fertility sa NCR, at ito, para bang binavalidate niya kasi fertility has really dropped in NCR. If I may just go through this quickly, minimum decline was in Mimaropa, highest is in NCR, and 1/6 of the national decline was due to the NCR, 1/6 due to Calabarzon. Probability that a woman with 4+ children will have another child declined from 19% to 4%. So women talaga are having less children. This is the sharpest decline with respect to order-specific rates. And so these are now the fertility rates by region. The red one shows the higher fertility rates. Of course, BARM has the highest. Then we have 12, I believe, and I'm sorry, this is another region. But you can see NCR here. So we're looking forward to the result of the 2024 National Demographic and Health Survey. So ang National Demographic and Health Survey in the past was every 5 years. Kaya 2017 to 2022. Kaya lang, because of the result of the sharp decline in the TFR, we requested, not just CPD, but I know DepDev as well, to have another NDHS earlier than 5 years. So they're doing the NDHS this year. So we're looking forward to the result of that. So ito na naman yung mga mortality rates. Nag-decline naman siya, pero hindi siya ganun ka sharp. So this is actually merong 1 percentage point increase dito sa infant mortality at saka sa neonatal mortality. This is naman modern family. Ang isang question talaga is this. The prevalence of the percentage of usage of modern contraception is not increasing as we would want. Well, as some would want, no? This is any modern method, the blue. This is any traditional method, and this is not currently using. So through the years, there is adoption naman of family planning. And through the years, there is an increase in the use of any modern method. But I would like to inform you that this 42%, according to studies, is actually not enough to produce the TFR of 1.9. Yun yung sinasabi ng experts. Hindi ako expert dito, no? So I was relying on them. Ang sabi nila, hindi nila ma-accept, yun ang unang lumabas sa 1.9. Yung 1.9, kasi nga yung modern contraception use is not that high. Pero sabi ko, baka naman meron na mga scientific traditional methods na ginagamit ang women. So that's one research area that can be used, done. But this is now where the alert is. We have always focused family planning, information, dissemination on married women. Because the assumption is the married women who are sexually active and would want to have children. Hindi na siya ganon. Nag-iba na yung panahon. We have now also sexually active unmarried women. And there is this gap, no? Yung sexually active unmarried women, 24% lang yung modern contraceptive prevalence rate. So we have to rethink our family planning dissemination to be inclusive, to include sexually active and married women. And this is where we now have this, I hope you know that last year there was a big debate or controversy about comprehensive sexuality education in school. And we had a bill, Senate Bill 1979, which it was supposed to be an act for to prevent adolescent pregnancy and to provide support to adolescent mothers and their children. One of the interventions for prevention is comprehensive sexuality education in schools. Namatay yung bill na yon just because of that strategy. So the author, Senator Hontiveros, actually changed her bill to remove comprehensive sexuality education just to address groups that don't like it there. But then na talaga, hindi na siya nakapasa. So the issue of providing this to unmarried women, the issue of informing adolescents in school about reproductive health is something controversial that we need to address. The most commonly used modern artificial method are still pills. And unmet, ito na yun, this is another very important note. Yung unmet need for family planning is just 12% for currently married women of reproductive age, but it's 42% for unmarried women. And total demand for family planning, mataas ang unmarried women, but it seems we are not able to provide them with what they need. And so this is a policy that we need to rethink with the Department of Health. Family planning reproductive health services are part of universal health care. Ang worry ko lang kasi, hindi siya explicitly sinasabi. At dito sa atin, pag hindi mo siya sinulat, makakalimutan siya. So, yun yung issue namin na walang mention of reproductive health services under universal health care, although DOH says it's there. And so, ito din, yung married versus unmarried. Uneven development across country and population groups. So we have decreasing maternal mortality ratio, but still higher than other ASEAN countries. So next year is ASEAN, and we always compare ourselves with our ASEAN neighbors or countries. Ito na yung labor force participation. Ang labor force participation rate of males is 77% in 2024. But 51.2% lang siya for female. So I was talking to Dr. Esguerra and to NS Dennis. Mainly kasi informal, yung women, although labor force participation rate ng women in informal sector are captured, no? LFS is able to capture informal sector. I would like to emphasize that. However, ito talaga, women are still not able to be part of the labor force because of care giving. Yun yung ano. Another issue na dinidiscuss namin with Dole is women returning to the labor force. Because we now have more young mothers who prefer to focus on their children. Pero once the children are already in school, they usually would want to go back to work. But it seems walang government facility to provide them with such opportunities. However, I know that many women now are in digital economy, gig economy. Ang issue naman namin is they are informal. So pag informal, wala silang social protection. Ang consequence noon is when they become older person. So ang gusto naman namin is the government should provide more facility for those in the informal sector to really have good pension plans. Although pwede naman silang mag-apply, mag-enroll sa SSS, no? But still parang kulang pa eh. So ito yung mga sinasabi namin. The good news about adolescent pregnancy is there is a declining declining adolescent pregnancy among 15 to 19. So bumababa na yung incidence of adolescent pregnancy for older adolescents, 15 to 19. The worrying one is there is a 63% increase from 2023 to 2024, or 22 to 2023. Noong 10 to 14, imagine, these are still children. So, in terms of intervention on adolescent pregnancy, it seems we focused on 15 to 19 and we forgot that nowadays, the children are exposed already to vulnerabilities 10 to 14. In fact, merong record ang PSA ng adolescent pregnant mother sa Tawi na 8 years old pa lang, no? Kasi they have their menstruation early. Of course, increasing urbanization rate due to internal migration, the rise of transnational families. Ito na yung sinasabi ko, OFW mothers. So, the rise of transnational families with feminization of international labor migration, leaving children without their mothers. And this is just to show you this is the trend of adolescent pregnancy for 15 to 19. This is a trend of adolescent pregnancy for 14 and below. I would like to emphasize, I'm talking about trends, no? But actually, in terms of level, mababa pa naman ang incidence nitong adolescent pregnancies. About 9.3% of all registered births are from adolescent mothers. 9.3. But still, the trend is something that we have to address. Please, PSA website is so full of information, and I'll just flash quickly just to tell you that because my advocacy is really adolescent health and development, youth at the forefront of SD, sustainable growth and development. Indicators are there for you to look at in the PSA website. Ito naman yung, we are now using support ratio as a measure of achievement of demographic dividend. And support ratio is the ratio of effective workers over effective consumers. And I'll just quickly show this without any information on the operational definition, formulas, no? Just want to show you that in 2017, this was a 2021 report, but the NDHS used was 2017. The CPH data was 2010. So kailangan ito i-update. Ang report was regions which are already reaping the benefits of demographic dividend are Calabarzon, Cordillera Autonomous Region, and the National Capital Region. So the higher the value of this, the better. This is the number of dependents per worker. Number of consumers per worker. This is the Philippines. So, hindi pa tayo nandyan because of pockets of lagging regions. And so the policy consideration for us to achieve the demographic dividend is really boost youth labor force participation in employment, improve financial literacy. So yung saving pattern, savings ng Filipinos ay isang issue. We really have to promote savings and put our savings in formal financial institutions. I would like to share with you that I did a study with Dr. Mapa like a decade ago, and we looked at saving pattern of Filipino households, and we found na tama yung sinasabi natin na ang mga matipid ay Ilocano at ang magastos ay Ilonggo. Lumabas yun. Ilonggo. So, mas malaki yung household saving ng nasa Ilocos region kaysa Visayas, Western Visayas specifically. But, saan ba nilalagay ang saving? Wala sa formal financial institution ang saving ng mga Ilocano. So ito yung in-alert namin sa Bangko Sentral ng Pilipinas, kaya they have financial literacy in the regions. Ang mga Ilonggo, Western Visayas, mas makonti yung saving, pero nilalagay sa formal financial institution. So that was a very important study which I believe the Bangko Sentral ng Pilipinas really used when they created their financial literacy centers. And of course, reduce wanted and unwanted fertility, pero at the core of this consideration is better education for the population. Now, just quickly, because I will show this to you, we have research gaps. There are some information that we need for policy, and we say we, this is not just CPD, but the agencies that are tasked to make the Population and Development Plan of Action happen. So we actually have a PopDev research agenda that accompanied the Population Development Plan of Action, and we identified priority research. And this is interrelationships between population and development variables, and they are very important to us. So we have the following areas, strategic areas. We have promote responsible parenthood and family planning. So we listed some knowledge gaps, and the research areas we say we need from you, the academe and the other researchers, would be further study of NDHS, identifying emerging determinants of fertility behaviors and family planning use among unmarried women. And let us wait for the 2024 NDHS, compare with the 2017, that's my suggestion. And we need to have a projection of fertility levels. We have already the fertility rate as estimated using NDHS, but we need projections. So if nothing is done, what will happen to total fertility rate? And the question is, paano to ang total fertility rate ng mga more educated and more higher wealth quintile ay mababa. Pero ang sinasabi naman ng aming qualitative research, nagde-delay lang sila to have children. So what does that mean really? Then another is impact assessment of operations research of our PFP program. So we have the law actually of 2012. Meron tayong reproductive, responsible parent and family planning law of 2012. Pero we really, hindi pa siya, my personal opinion, evaluation reports lang ang aming ginagawa with the lead, DOH's lead. Pero impact assessment, hindi pa. And cost-benefit studies on family planning, return of investment. Si UNFPA globally, meron na siyang mga studies on return of investment on family planning. Research area under advancing adolescent health and development, the conduct of the YAFs. So UP Population Institute, ito nilabas na nila yung last wave nila, and they said we can actually request for data to do further study. So ang importance ng YAFs, inaaral talaga na nila yung risky behavior ng mga ating adults and the mga sexual behavior din nila. Then, in the discussions we're having here in the Social Development Committee in the Philippines and in international meetings that I'm attending on population development, there is, we're going back to the family and the parent and child dynamics. So, how do we, promote and enhance family? How do you support families in terms of raising children? And so, ang nakita ko yung Thailand, ang kanilang social sector, nag-focus sila ngayon yung framework nila for social development is family. Pero ina-alert ako ng UNFPA, be careful kasi hidden, especially for Arab countries, they're promoting family because they don't want comprehensive sexuality education in schools. So may mga ganong hidden reason why family is being promoted. And studies on dynamics of parent-child communication, on sexuality-related concerns, studies on determinants of pregnancies among children. There are actually studies already done on this, and the main determinants na nakikita sa studies are poverty pa rin, and issues in family. So maraming mga bata umalis sa family, nakiki-cohabitate kasi hindi maganda yung relationship with parents. And of course, impact assessment on our adolescent health and development. Also supporting labor force empowerment and active healthy aging. So we have again projections on measuring potential impact of increasing human resource employment and economic outcomes, updating estimation of support ratio and quantification of demographic dividend. Yung naka-highlight, yun yung priority namin. Studies on the RH needs of the marginalized population. We're looking at farmers, the poor, these are the lower educated women. Studies on human mobility and employment. Studies on the emerging needs of older persons. Studies on demographic and socioeconomic impact of the aging population. We also have another strategic area to accelerate inclusive development among marginal sectors of the population. And ina-alert kami na IPs pa rin ang issue, yung mga information and studies for the IPs, pero nadadagdag yung persons with disability. The hearing impaired specifically was what was alerted in one meeting that I had on the Social Development Committee. Now also is the environment, population, environment, economy nexus. So itong climate change issues. And integrating population agenda in sectoral development. Ito na yun, na ginagawa na namin ngayon ito, establishing methodology and actual estimation of data and population, research on population and development interlinkages in various contexts. And this is where we really need the academe. Strengthen people-centered regional and local development. So, itong aming localization efforts, nakakapagod siya kasi there are 1,600 cities, municipalities, there are 42,000 barangays. So, how do you reach them? So, ang strategy ng Commission Population Development is to strengthen the provincial population offices para sila ang mag-cascade ng technical assistance to the municipalities and barangays. I hope you don't mind, I will, yun na pala, and the data sources that we usually look at are, of course, PSA is our main, and then we have this longitudinal studies this one is Population Institute, this one is Office of Population Studies at University of San Carlos, this one is also Population Institute, and they say that their data are available for those who would like to study. And these are some of the references that we have. Thank you very much for your kind attention.
There's a little bit for everyone, both students and researchers here. But if there are any questions from the group, can you just raise your hand? Ada.
Ma'am, it was mentioned earlier that a consideration with respect to behavior of children is whether they're left behind. For example, for mothers who move abroad. Have there been is there an issue, ma'am, in the Philippines regarding, say, internal migrants? Let's say the mother is an internal migrant to NCR. Have there been issues with the behavior of children left behind in the province, if any po sa Pilipinas? Curiosity lang po.
We have not done that study actually. So, mas rich pa nga ang data on international migration kaysa internal. Mas problematic yung internal. That is why we are advocating for our registry of barangay inhabitants and migrants, because this registry has information on internal migration. And we've been talking to PSA kasi mandated sila to do CBMS, and then we're talking to the LG kasi meron din silang barangay information management system. So nahihilo na yung mga barangay sa kadami-dami namin pumupunta doon. So we said, well, let us put our heads together, and then we will say, oh, it seems the other databases don't have internal migration information, so yun yung amin. But the others will be, yes. So ito pa yung data gap, which will then be also research gap. But we are now starting looking at how we can capture issues of internal migration sa Region 6. Specifically sa Malay. Kasi marami ang internal migrants sa Malay, Boracay, because of tourism. Oo. Yeah. Thank you for that.
So, hi, ma'am. First of all, thank you for the presentation. It's quite an education. Being, more than 10 years din ako nasa States bago umuwi. So, and then sayang kasi I just literally lectured on social determinants of health this week sa health.
Okay.
So, I'll probably present some of the slides.
Please do.
Sweet.
Yeah.
So, just a few questions, ma'am. So, actually, so na-mention nyo actually just a few minutes ago yung sa international migration data. I'm actually interested in that. And so anong mga klaseng data yung available? Is it just counts or meron din bang mga surveys na medyo comprehensive about that? Kasi alam ko like yung IPA dati meron silang mga ganyang klaseng projects on remittances. So I don't know if merong mga ganong din klaseng data na available on that.
Okay.
Especially health side.
Yes. First of all, nung na-create ang PSA, we had to discuss what really our definition is on migration. Kasi iba-iba yung definition. Bangko Sentral ng Pilipinas, in charge of remittances, may sarili definition. Bureau of Immigration, may sarili. So the good news is we already have a standard. May framework na tayo on migration data. And you can download the actual definitions, operational definitions and framework. You can download from the PSA website. As nandun yung sa board resolutions nila. So you can download. And so, klaro kung anong mga types of information ang makukuha from different government agencies. PSA, the sources of international migration information are their survey of overseas workers na they do this every October round of the labor force survey. Then we have National Migration Survey. The first time it was done was 2018. Dapat siya makapture niya yung internal and international. Pero hindi niya na-capture masyado yung internal, more na-capture yung international. This year, magna-National Migration Survey ulit. So, yun yung mga another. Of course, yung administrative data ng DMW at ng DOLE could be sources of international migration data.
May health questions doon, ma'am, sa mga surveys?
I don't think so. The NDHS is the one that will capture health information. This was an issue we had when we wrote the first international report on health of refugees and migrants. Na almost all countries wala siyang survey specifically for health of international migrants. But we found that the NDHS captures some of it.
And then, ma'am, another interest of mine yung sa aging side. So, I mean, it's been talked around yung longitudinal study of age. So I'm actually going to reach out.
Yeah, they're LSAP. Yeah, oo.
So I was wondering kung meron bang what's the picture sa labor LFP ng mga older when you were talking about like the silver dividend, what's the current sort of landscape there, and then meron din bang is dementia and like cognitive sort of problems already becoming a problem in the Philippines?
You know, ang labor force survey kasi, ang kanyang coverage ay working age population. So, 14 to 64. Oo. So, yung information for older persons as regards labor force participation, I don't know kung makapture ng labor force survey. Ang pinaka-source natin siguro of information would be family income and expenditure survey kasi nililista pa rin naman lahat ng members ng household, and census. Pero si census, hindi ko na maalala, but those are possible, no? Wala siyang...
Limited lang yung labor market.
Oo. Yeah, kasi auxiliary information lang ang census eh. So most probably FIES.
Yung census data available?
The 2020, if you ask. Oo. But when you write to... Wala pa yatang microdata ang PSA kasi masyadong malaki yung census. So when you ask for information, you will have to tell them what indicators or data you need. Oo.
Ma'am, yung sa LSAP, they have a little bit about the employment and also some measure of the cognitive but not very extensive. They just have a tool. Oo. Pero hindi talaga siya validated. But it's really, what they did was to use it as a screening instrument to actually identify whether they can interview the older person or whether they need to have a proxy respondent on behalf of the older person. Yun yung sa cognitive, as we use that variable. But then, I think the employment is also something that they have, and it would be interesting to find the pattern of employment. Ang suspetsya namin is that it's more on the poorer because they're supporting their apo and all, but also among the richer who are probably more skilled and more ganyan. So because
More in demand.
no, but I mean, that's something that we can validate. I haven't looked at it, but that's so the middle ones. Yung mga nagre-retire kami yun.
I will send you the link, Carl and Marie, the link to the IMF study on silver dividend. Dito nila sinabi na yun na nga, yung dapat ang countries hindi naglo-lower ng age of retirement. Kasi may impact siya sa economy, sa achievement ng demographic dividend. Pero they studied cognitive issues of older people. Ang naalala ko, up to 70 years old, yung cognitive ability ng older persons, okay pa. To be part of labor force. Pero 70 dito daw yung cognitive ability magde-decline. Pero naalala ko yung nanay ko sabi niya, Lisa, yung mga brain cells natin nag-degenerate niyan. Kailangan mo lang may problema ka na isosolve para kasi I asked her, Nay, bakit ka pa ba nagbi-business? Tapos nagre-reklamo ka sa problema mo sa business mo. Yun yung rason niya sa akin noon. But it's really being more active. Yung problem sa older people na naging klaro sa akin doon sa IMF study, may indicators sila on the physical grip. Grip daw is an indicator of how fast you're aging. Oo. Interesting.
No, no, just commenting on that. It's the legs, diba, that the weekend first, I think. Yeah, your knees, or so that too. But then I suppose even if your legs are weakened and all, you can still work, right? I mean,
Actually, we are just encouraged to move. Usually, well, I hope you don't mind to share my personal experience. In the morning, nahirapan na ako sa aking movements. Oo. But once I start my day, ano na siya? Nag-move na siya. I mean, I'm okay. So, and my doctor actually told me, ma'am, okay nga sa older persons to be still engaged in activities, whether it's for income or not. Because nakikita niya, yung older persons that are sedentary, they don't have anything to do when they wake up. Doon yung faster deterioration. Naalala ko tuloy sa UP, di ba hanggang 70 ba ang... Sabi ko, ano ba ang UP na study na hanggang 70 ang professor? Ganon pa ba yun? Yung maging professorial chair? Oo, right.
up to 70 can get reappointed.
Yes. Oo. Right. So I was wondering when I heard the IMF study, UP based it on some research that says. So ito yung mga policy decisions that should be made using evidences. Yes, Carl.
Ikaw muna, sige.
I know this is going to be a repetitive question, but it's about the workforce trends.
Okay.
Are there any research? I know you've already said that there's not a lot, but perhaps are there any research about fresh grads' level of employability and their preparedness and ease of entrance into the labor sector?
Okay. I have a paper that looked at graduates of, educational attainment and informality. And I can also share the link. So the link to the IMF study and to the EDCOM paper. If you are a college graduate and also masteral or PhD, you are usually in the formal sector. For me, ang worrying yung nag-college pero hindi niya natapos. How do we call this? Basta yung mga college, with college units, let me say that. Sila malaki ang chance ng nasa informal sector. Kaya sayang yung investment for them to be in college na hindi nila matatapos. Yun. Of course, no education, elementary, yun. Ang laki ng chance ng being in the informal sector. Yung graduates ng secondary high school education, medyo fuzzy yung data. Maybe it's because talagang hindi muna sila pumupunta looking for employment kasi they go to college. Pero yung part ng studies shows na if the individual has the TechVoc training, tumataas yung chance niya sa formal sector. Kaya sinusulong din ngayon ng TechVoc.
Also, one last question. Are there any data on opportunity costs due to brain drain or immigration, and which kind of institutions would do this kind of research?
I'm sorry, I have no information on that one.
Okay, thank you.
Thank you.
Thank you.
Hi, ma'am. Is it on? Thank you po sa discussion today. I'm Harry po, graduate student here at UPSE. Ask ko lang po sana, saan po kaya magandang tumingin or kumuha ng data on childcare, elderly care, household work? Specifically, yung interest ko po kasi ngayon is how the elderly can encourage labor force participation among younger workers, specifically for women. So yung angle na tinitignan ko po is if yung older relatives or grandparents is living with the family, if they are taking up household responsibilities, maybe that could be part of the silver dividend na ma-encourage mag-work yung mother.
Actually, this is very important because we are now, even internationally, talking about intergenerational relations.
Yes, ma'am.
And this is consistent with going back to the family. So it's the intergenerational, relationships that could help in demographic dividend. Ewan ko lang, I think FIES siguro, but I'm not sure. Any survey that has information on class of worker, including caregiving, yung unpaid family work.
Meron limited
Oo.
Sa ENSAP kasi sinabi lang yung roster, pero meron silang ganong categories ng labor. Pero,
In ELSAP, we're exploring, advice is exploring actually the caregiving burden because we're population is aging. So we're trying to see, the cost of caregiving for the caregiver. We're trying to see ano ba yung opportunity cost niya. Unfortunately, we're trying to just, because most of the data is on the older person, not a lot of data is on the caregiver. So we have to be creative about, given the characteristics of the caregiver, education, age, whatever, what would have been their wage?
Right.
So if you are trying to, estimate how much it would cost, what is the opportunity cost of caregiving, sana matapos na niya. Pero hindi pa.
halimbawa, may regression kayo using LFS data to impute wage.
Yes, because what we're trying to do is like, okay, what would have been the wage of this person? Kung using hedonics lang. And also the educational level,
Smart.
what they call this, even the occupation. Kasi there in LFS may may caregivers meron. So ano ba yung wage nun? And what would, but so that's hopefully one way to estimate. And because the policy question there is, these are not that we are saying that they're not being productive by caregiving, but if you move them to the formal sector, this would have been what they would be earning or contributing. So the policy question there is, kasi in some countries, diba, the elderly are, well, caregiving is subsidized, that's right. The other is that the caregivers are not participating in the labor force, and also in some countries mas institutionalized yung caregiving for older persons, hindi family. So parang may relationship doon somewhere. But I'm sure there's still one thing that we are, but there's no data on the LSAP. But this is part of what si Dr. Horioka is studying. Ano ba yung motives ng children for giving care to their parents? Is it love, or is it because they want to inherit or something? And even the motives of the parents, what will they, who will they give their mana to? Bequest. Pero, so it's, there's data, there are limits, but, we try to do what we can.
May I suggest you also look at, do research of what are published in other countries. Kasi in India, for example, I remember noon, meron silang grandmother project where grandmothers in a community are the ones doing caregiving to the children because the mothers of the community go out for work. So this is now a community level support to the family. Hindi din siya institution, hindi siya family, pero community level. I think maraming ganong study sa other countries. In fact, meron ng ibang countries na meron na silang law about filial responsibility na required ang children. Merong bill si Senator Lacson. Because some countries, in other countries talaga may law na sila for they call it filial responsibility.
May ano lang ako, ang DepDep ba meron mga RFP, for example, for mga research grants?
Meron tayong program convergence budgeting. In fact, PCED, I think, was able to get, di ba? Budget sa training. Oo. So, that one. Kailan big ticket budget siya. So, merong ganon. So, meron siyang program convergence budgeting for SDGs, for water, for... Ayan, alam mo yan ni Sarah. Oo.
Sorry, yes. Personal curiosity lang po. Has there been any interest in maybe in the link of alcoholism to the incidence of teenage or childhood pregnancy? Maybe this is adjacent to domestic abuse even. And maybe could it be like a driver of...
Yeah, risky behavior. So YAFs. YAFs is where you can get information and data on that.
Pero ano yung sa YAS para, kasi dinexer ko din yung Tuesday, para on the decline na yung among adolescents. So parang nasa 20% na lang yata yung, I forgot which year was that, parang 2022 ba or 20? Yeah. Parang on the question na did you have alcohol consumption or cigarette, the previous week parang nasa 20% na lang siya from mga 40 back in the 90s.
Okay, that's good.
Yeah.
Mas konti na nga ang youth ngayon na nag...
It's a global phenomenon then.
Pero kasama na ba ang vaping dyan sa question?
Yun ang hindi ko
Kasi
alam, ma'am.
alam ko
I think
yung
parang
vaping.
wala pa.
Oo. But also, yung another risky behavior of the youth are transport. Nag-release kasi si PSA nung cause of death statistics for the youth. Transport accidents, number 1. Land transport accidents, number 1 siya. Yes.
Hello, ma'am. It's me again po. Sorry, ma'am, may question lang po since I used to teach courses in demography.
Okay,
Tas, ma'am, I'm hoping
okay,
migration
good.
po. Since nabanggit niyo po earlier that mas rich yung data po natin for international migrants. At the moment, ma'am, I'm hoping to work on repeat migrants, yung mga nag-migrate once internationally, umuwi perhaps momentarily,
Okay,
then perhaps
oo,
moved again.
oo,
Ma'am, what data sets would you recommend to work on? Since, ma'am, at the moment, yung na-explore ko is the migration survey. So, is one version pa lang po yung meron, right? It's from 2018. Is there any alternative data set that is as rich as the NMS? Kasi siya po yung nakita ko na if you moved internationally, how many children did you leave behind? Did you receive ORS support? Meron pa po ba tayong ibang...
Yung repeat.
Yes, ma'am.
I'm not sure if yung survey of overseas Filipinos would give you that information. Yun lang yung naisip ko.
Sorry, napapadami.
That's okay.
So, yung mga ganitong surveys kaya, ma'am, are there ways to sort of link them to other administrative data? So like, would there be like a PhilHealth number, for example, for some of the data? Like kasi sa states, they can link, your Medicare data with some of the surveys. So yung, meron silang survey on parang aging din na nakukuha nila yung Medicare number, so nakukuha nila yung utilization using Medicare. So I don't know if may ganun na rin dito sa Philippines na malilink siya. I know tax data is hard to obtain here, pero parang merong bang mga variables na pwede siyang i-link to other admin data?
Yes. For household surveys,
Wala pa eh.
wala pa talaga. Oo. And the vision is the national ID number will be the one that will make all of this survey data, administrative data interoperable.
Yeah, kasi that would be rich. Yeah.
Yeah.
I noticed kasi one of our problems is really wasting, stunting. But the National Nutrition Survey is not as open to be used, and also I'm not sure whether there are a lot of social demographic variables in the NNS that can be used. But I think sana there's a way to probably link it with FIES or the master data set so that the information is, you can just get the information on the household from the FIES. Kasi I'm not sure what the sampling frame of NNS is.
They get from PSA. So
They get-
on linking, so we don't have yet on the individual level talaga na ID number. But if the survey is based on the master sample of PSA, then there is possibility of linking FIES, well, definitely yung mga PSA, yung FIES at saka LFS at saka census, malilink mo yan. But I know that the ENNS is based on a master sample of PSA. Yun na nga lang na hindi masyadong madaling makakuha ng data.
It's an understatement na hindi madaling magkita. Room for one more question siguro because it's getting late. With Zoom, mayroon yata
Oh, yeah, we have...
or comment?
Here.
Just being choosy in non-college graduates. Yun on the comment. Yung point yung kanina, ma'am, na yung some college units nagiging informal.
Yeah. So this is a comment. Okay, thank you.
So, I guess this is the part where we thank our speaker, Professor Dr. and National Statistician Lisa Grace.
Before.
Thank you so much for
Thank you.
the very engaging lecture. And we don't know, this has been like nearly 2 hours, but it's been very engaging. And thank you so much for attending.
Thank you.
And there's food there. We formally closed this one, but you can talk to Dr. Bersales on the sidelines if she's not going on yet.
Thank you so much. This was a very good experience for me. And looking forward to all the studies that you will produce. Thank you.
Thank you very much po. Yeah, I just joined the faculty sa school na as I'm a health economist at saka
This is a
physician.
PhD in economics and a medical doctor.